Welcome to the Mindful Pause podcast, where we talk about all things mental health and service dogs. I'm your host, Laura Mudge, a passionate advocate and handler of a small service dog who's been by my side offering life-saving support through some of the most challenging moments of my life. While I'm not a medical professional, I've experienced firsthand the impact a service dog can have on someone's mental health. And this podcast is the space for sharing stories, insights, and resources. Through conversations with experts, service dog handlers, and mental health advocates, we'll explore this unique bond between humans and their service dogs, and how these animals provide both emotional and practical support. I'm excited to dive into these stories with you, and I hope you leave each episode with a better understanding of the healing powers of our four-legged friends. On today's show, we have Katy Collins, who is a service dog handler who also has PTSD, just like me, and she self-trains her dogs. Please welcome Katy to the show.
Thank you so much for welcoming me today, and I'm looking forward to this talk and just opening up a little bit about not only my story, but sharing maybe new things that could help other owner handlers. So thank you for the invite.
Well, thank you for joining us. It's always great to hear people's stories. And I always think it's important to share because someone who might be going through something similar can then, relate to that. And I think PTSD has a lot of different things when it comes to it. And people don't realize. They're just like, oh, and I even hear it in dialogue sometimes. That gave me PTSD. And it's like just a joke almost. Yeah. And so I wanted to I felt really wonderful that you reached out and you wanted to come on the show today. So thank you so much.
You're welcome.
Do you want to kind of start with your journey and what happened to lead you to be working with a service dog?
Sure. I'm actually fairly new to service dogs. I've always heard of them. Never really seen them, honestly, too much until semi-recently once I, was in the community myself. But I was recently, within the last 2 years, diagnosed with PTSD. Mine stems from childhood and adoption trauma. So it's a little different than what most people hear with PTSD. They think of veterans coming home from war that are having a hard time acclimating to civilian life, or PTSD from some other form of not so great things in their life. So mine stems from something a little different, but it's been a journey so far, and one that's taken step by step, but that's where my service dog journey has started and stemmed from. So.
Well, thank you for sharing that, because I feel the same way. My trauma comes from a lot of, my mother was very ill, my brother, my father, people were ill in my family. So my PTSD comes from a lot of medical related, seeing your loved ones in pain and having to be that person that kind of steps up. And I think that a lot of people think that it is just for veterans or first responders, and they don't understand that it can stem from abuse. It can also stem from just very traumatic things happening in your life, natural disasters even, and things like that. And sometimes, especially with childhood trauma, we think, oh, well, no one's childhood is perfect and all that stuff. And yeah, that's true. But at the same time, when it's ongoing like that, it affects your brain permanently, because within those first 5 years of your life and in your teens and like all through your childhood, your brain is developing. So your body is learning different ways of dealing with anxiety and dealing
survival
with
pretty much.
Yeah, you are stuck in survival because that has worked for you. So when you move into adult life, like I smell a smell, that reminds me of something. My body goes automatically into that. I hear a sound, or I have a night terror or a flashback. All those things can stem just from walking through daily life. And it's a program which kept me safe when I was young. And now that I'm older and I'm trying to survive in the world, It's not helping me. Right. So I think that's really important to talk about. And it's really brave of you to talk about it. And I appreciate that because people don't understand it physically changes your brain. It's
Exactly.
not like you can just get over it.
If it was that easy, it would be a lot more less challenging, especially day to day, like you said, as an adult.
Yeah. Yeah, exactly. And that's something I think with a lot of mental health things that we hear about. People are like, oh, well, you're just sad, or you're just anxious, or you're just, when you say flashback, they don't understand. It is a lot like television. Sometimes you see there's a few movies or something like that where they flash back to what happened.
Yeah.
It's like that. Like you smell, you hear, you feel. And yeah.
You hit the nail on the head with that, because it's just more than the mental side. It's the mental side brings on so many physical symptoms as well. So it depends on each person.
Totally.
It depends what abuse and circumstances they've been through. But I feel like in the end, everyone is the same in the sense of what struggles they go through, and there's going to be hard times. It's finding what works for you, whether it's a service dog. I know some people, medication helps really well. Journaling, there's other things that work really well for other people, therapy. So it's just a process of what works for you in this healing journey. It's
exactly. And there's no wrong answers.
No.
I want to say that too, because for some people like myself, sometimes when I'm having a really bad day, I have to take medication. And sometimes if I'm having a low few months, I need to take medication. And that can be something that there should be no shame of, because if I had a broken leg or a migraine or a bad back, I'd be taking medication. Right. And that's a stigma that needs to be, talked about as well. And sometimes therapy does work. Now, I don't know what your journey is. My journey is I still do therapy with a trauma therapist. And I have done therapy all my life, like on and off all my life. And I've tried every medication and I've tried all that. And I found that my service dog has literally been my best prescription. Yeah.
It's a different world, but it definitely helps in more ways than I thought it would. I thought it would be more, not of a hindrance, but you have imposter syndrome pop up. Like, is this really worth it? Is this something that I really need? But like you mentioned, therapy really helps go through those steps. And personally, therapy helped for a while, but like you mentioned, finding a good therapist that knows about trauma is important. And I personally didn't know that until just recently.
Me too.
As an adult. So by the time I went through all these therapists, I'm not saying they didn't help. They did at that time. Now in my life, I feel like I've done a lot of the hard work without going to therapy. And now the service dog is helping me day to day be able to help with my physical symptoms more so than the mental side.
Exactly. So. It's for my dog. I don't know. We'll go into a little bit about what your dog does for you. I know with my dog, she alerts to my anxiety levels raising. So she'll tap me on the leg. She's like 5 pounds, by the way. So
she's so cute, by the way.
Thank you. So she kind of has to jump up to alert, right? Yeah. Obviously. And she'll let me know. And then I get to use those tools. So then I get to use my mindfulness. I get to use my grounding techniques, finding those moments where, I pick a color randomly or or start with the alphabet and say, find something with A, B, C, D, just to bring me into the moment, or even just taking a few cleansing breaths, right? Exactly. So all of those things can help physically and mentally, but the alert has made it so it hasn't gotten to all of a sudden I'm at a 10.5. Exactly. I'm having a panic attack or a flashback and I can't cope. So that's what she does for me mostly. And she does other things like nightmare interruption, And like if I'm disassociated, and she also helps calm me down with direct pressure therapy. So like that's kind of the way I use her on a daily basis to deal with my PTSD. Would you like to talk a little bit about how you're using your dog?
Sure. He's fairly new. I actually have a fully trained service dog. She's more for when I need her in public though. Just because she's a great dog. She's full, like I said, fully task trained. However, not what I personally am wanting and needing long term for how things have progressed in some ways. Um, so he is oh gosh, 8 months now. I've had him for going on 3 months. He's a standard poodle named Velvet.
Oh,
Um, so we're just starting the basics, getting out, socializing, working on the basic obedience in public, meeting new people. He's doing really well in that area. So he currently does alert to my impeding anxiety attacks as well as I'm slowly trying to work in the heart rate, just so that way I kind of know more specifically if it is heart rate or anxiety, because right now sometimes it's a toss up,
yeah.
whether it is heart rate or anxiety.
Mhm.
But his main task will be mobility and light mobility once he's older. So right now he does deep pressure therapy and light pressure therapy as well, and then the alerting to the impeding anxiety. And then we'll do little things where he helps me with tasks and whatnot, reminders, and on those, because those are my personally bad days when I have those hard days. Mentally, it's hard for me to keep track, stay on track, just because of things that have happened in the past. So having that as a little reminder and just keeping him on track of what he enjoys, that also helps. Just me mentally being on a good track some days, because
Totally. Like taking your dog out for a walk. I think I talked about that on another one of my podcasts, where it's like just, having that routine, taking them for a walk and feeding them.
exactly, yeah.
If I'm having a bad mental day, I will forget to feed my dog and she will go get her dish and throw it. And then I'll be like, "Oh yeah, I'm
That's smart.
sorry. I'm
Yeah,
really, really sorry."
they won't let
Um,
you forget.
they don't let you forget, which is important, because and that's the thing, is like you're just like, okay, you need this, or she'll dig at her water bowl, she's out of water because I've just phased out. Because sometimes when you have PTSD, you've had a real crappy sleep and your anxiety is at really high in my situation anyways, and I will just zone out, and then it'll be like 4 hours of just zoning out and then not realize, and she helps interrupt that, so
It can be tough, especially when you are not, I don't want to say go type of person, but I'm fairly active, and
mhm.
with everything I have going on, it's hard when I do have those episodes, and especially when you disassociate, it can be exhausting. I don't think a lot of people realize too how, not just mentally, and we talked about a little bit physically, but draining and how fatigued you can feel after some of your episodes. So it's not always just the episode itself, like we kind of touched on, but what happens after that can take, like you said, it could take you several hours or a full day just to recover.
Yeah.
But having something that is that reminder of like, hey, that dog's here to help me. I don't have to worry about my next episode. I can, focus on my tasks. And if something happens, have that as your form of help. So that's the biggest thing that.
Yeah, it helps you kind of stay on track, totally. And I know, like, for myself, it's difficult some days too, because you're like trying to, at one point, like right now, I've not been working because I can't maintain it. This is like an hour's work of like just a hobby to keep my skills sharp. And I do this podcast for awareness. And I like to hold a full-time job right now. There is no way, because I'm still having episodes
Yeah.
and I'm not at a perfectly level place right now. And I think it's fine to say this because I know there's a lot of people that are like that too.
Exactly. And you
Yeah.
need it. need to be able to take that and look at it and analyze it. Oh, I can't even talk. So it's, yeah, no, it's important. And not to be hard on yourself either.
Exactly. Like everyone's at different levels. It's kind of like this is a little bit of therapy for me too, because it realizes that I'm not alone in this journey, and there's lots of other people that are going through this. And that's why I thought, I know posting on the internet probably have some of my family members go, but at the same,
good information, and
I think it's really good information.
Different perspectives, different viewpoints, and
exactly.
No, it's great.
Yeah, but definitely recovery is a big part of PTSD. I find like I have like little bursts of energy where I can do like the things, like currently right now, I'm not at my best. So it's like, I have maybe 2-3 hours a day where I can at most to like actually get stuff done, and the rest is like literally just trying to look after myself and keep myself out of that full blown panic attack. Right.
Oh,
and there's a lot of places, there's a lot of times in people's lives where, you go up and down in that battle. Right.
And that's a part of the journey that regardless of what you're going through, you're going to have those ups and downs. And the biggest thing is how you take those challenges in your life, and having that not only companion, but that reassurance of things will be okay has been the biggest change. And I know a lot of people may even look at a service dog and say, you know what, they may be beneficial to me, but the work may be too much.
Yeah.
But in the end, you have to do what's best for you, and having that, like I said, reassurance of I will be okay because he will help me through this a lot quicker than, like you were saying, on your own. It can cut down that recovery time so much quicker than if not. And I even notice a difference if I have an episode and he's napping or, playing and not in the same room as me. He comes in, of course, when he notices if, we're not in the same area, and he knows his job very well for a young puppy. But it's definitely, even in the last like couple weeks, I've seen a huge improvement in the consistency of not only my mental health, and I don't want to say improving, because like you said, it goes up and down.
It goes up and down, but you're feeling more stable.
That's been going on in my life. This is probably the best it's been after a lot of hard things going on. I don't usually recover as quickly mentally after a lot of challenging things. Just because, in the healing journey it can be challenging. So he has definitely helped in that recovery time of, okay, it could take me weeks. It may be a couple days. So there's been a lot of benefits that I was not seeing until, you start working with them. Right?
Exactly. And I thought it was a little bit crazy because I had a dog that was my mother's dog. And when my mother passed, I took care of it. And I told myself, I'm never getting another dog. And then my doctor was like, no, I really think you should get a dog for nothing else. If not emotional support, a service dog, because maybe you can pull yourself out of some of these things. Yeah. And that was the best thing that ever happened. But I did go through that. Oh my goodness, how am I going to do this? How am I going to afford it? How am I going to, there's, pets are not cheap. Service dogs are not cheap. You're spending money on training. My dog is addicted to dried chicken. It costs a lot of money. Right?
The things we do for them.
I know. And she has outfits. It's like a whole thing, right? Like she's little, so gets cold. And it's a whole thing, right? And grooming, you have a poodle, so you understand the grooming.
Oh, I do that myself. I gave up. I have a great groomer, but it's just easier. We live in the country, so a quick shave job, he's good to go.
Yeah, I don't think my Morkie would look very good shaved, but I have considered it a couple times. She'll just shave it all.
Make her look like a little lion.
Yeah, she'll just just have like the tuft around. Yeah. But yeah, so there's a lot to be said like about that, because I do get when people first get that diagnosis or suggestion, like, or have come across something like this podcast and like, oh, maybe a service dog would help me with my PTSD or mental health condition. Just having that moment of, oh, wait, what is that involved? It is involved, and it is a process. And like, you can go through a couple dogs and you can think you have the right fit, and then it just doesn't work or something happens.
And that's not talked enough about, is what really goes into not only training, but the temperament, finding the right candidate. And that's more important than, I believe, anything else, because like you mentioned, you have to have the right fit. Otherwise you're washing. And then if you're washing, you have to consider, well, can I keep this dog? Do I find a new home? And then I've talked to several people that are on their fourth or fifth service dog because for one reason or another, something doesn't work out. So it's one of those that it's a lot. It can be a lot.
It can be a lot, and it's a financial investment, and there's not a lot of programs. And I think talking to someone else who has PTSD, you've probably run into that, where there's programs for PTSD dogs for veterans, and they have them for first responders, but they don't necessarily have them for people with childhood trauma. And when you have childhood trauma, it's not like I'm going to have a dog and then I'm going to be great and I'm perfect. Not that you would be if you were a veteran or a first responder. Let me be clear.
No,
I know let me be super clear. Yeah. But it's a similar severity. And it's been programmed in at an early age. So it's not like you had that great, that strong upbringing where you feel secure and you don't have that anxious tendency. But because the PTSD developed younger, then it just it stays there. It's harder to unprogram. And I've done all these whack things. Like I have tried hypnotherapy. I've tried standing on my head on a full moon upside down or whatever. Like I've tried literally, you can think of all the things.
Desperate almost sometimes.
Yes, I have been very desperate because I just don't want to feel like this anymore. And I've had that talk with my doctors. Like I cannot feel like this anymore. Right.
It's hard because even medication takes time.
Yeah.
So, and that doesn't always sit well with certain people, or I'm not saying as far as, the right kind, you have to find the right dosage.
Oh, there's a million kinds.
Exactly. So having the service dog at least gives you that option of having something helping right then and there. Even if it's just at home, even if it's something that you can't really afford to take out right now because you're not able to, having that at home service dog can be just as valuable as the fully public trained one.
And it's a total support throughout whatever that journey of healing brings to you. Right. So, I'm at the therapist or I'm doing something like that, or going to the doctor's office. Like doctor's offices are like the worst for me because of all the smells and all the triggers. But I have my dog and then I can go do that. And even, if you haven't found the right combination of medication yet, at least you have a friend beside you giving you light pressure therapy, helping you be mindful and not zone out. And that is tremendous.
It is. It's especially like you say with doctors. I also have my own issues with doctors, and a lot of people are like, well, that's silly. Why would you have that? And when you explain to them, some understand, and then some are like, well, that's still silly. But until you have experienced a lot of the things, it's hard to explain to somebody to have them understand. And you can explain it to them in 20 different ways. So it's just sometimes better to say something quick and polite, and it can be tough sometimes, but
totally. It can be depending on the situation. And I mean, doctors, they do their best, but they're humans too. And it can be a challenge for them as well. We're not slamming doctors here or medical things, but we've had trauma related to that. And I think, that's fair.
Exactly. And that's where I like to bring up on all aspects, because my personal experience, I have not had a therapist once tell me I had PTSD until this one specifically. And I'm in a completely different state. So I don't know if maybe the questions that they ask, because I've never had someone sit down and ask, specific questions and
Mhm.
really dive deep into, you know, certain issues. So, um, I always knew something was going on. Like, not that I'm not normal, but you always have that thought, like, do other people think like this? Do other
Yeah.
people have these processes? Are they struggling like this in these ways? And so it was just, in a way, a relief to know that, okay, this is what it is. Now I can work towards something
Mhm.
XYZ. And knowing that more definitively has also helped in my healing, because now that I know for sure, because you question things like, well, could it be this? You try and self-diagnose yourself,
Oh,
and
totally.
Dr. Google here.
Yeah.
So it's hard when you don't have that for sure diagnosis. And it's kind of opening up a door where I do want to go talk to someone more to see, if there's other things that I can work through. But right now I'm very happy with where I'm at. So just kind of taking a pause and a breather and
Yeah, and it's a lot to
working with
unbury sometimes,
it is.
and that's the thing too with PTSD when you're trying to work through it, even with like trauma counseling, it's a lot to unbury, and sometimes, quite honestly, I don't want to effing go there, right? Like I just don't. And it's just like I just want to get through today, and that flashback I just had, I I don't want to talk about it, you know.
No,
So
it's
it's
like
it's it's
day by
hard,
day.
but you probably should talk about it so you can heal it. But I was always like through my whole life, I'm sure you maybe had this too because you've had childhood trauma, where it was just like suck it up, buttercup, move on to the next thing, keep busy, keep going, keep going, keep going, and then you burn out, and then you're sick, and then you're like,
Yeah,
oh, maybe I pushed too hard. But then where do you go from here? So it wasn't until recently, I started talking to a trauma counselor where it was like, okay, maybe we need to start dealing with some of these things.
exactly.
Right.
It, um, like you said, it's a lot to unpack, but the biggest thing is the thinking it through.
Mhm.
That alone was enough for me to shut down and be like, I'm not, that's why I never went to therapy at first, because just not talking about it, but having to think about it and
Mhm.
really, go through the whys and the hows and the whos. And, like you said, breaking that apart and really getting to the root of, well, why is this the way that it is? Sometimes you don't know.
No,
Sometimes
we just don't
it's,
know.
it's part of what you've been through. But ultimately it's always better to talk to someone.
It
Always.
is always reach out and always keep trying. Like that's one thing I have to say. And obviously you are a very similar person to me as far as I am not going to give up.
No.
I'm going to
After
find
everything we've been through, I
no
don't think
friggin'
some of
way.
the things that we're
Put
going
me in the
through
tiger's
now,
den. I'm not giving up.
no.
Right. And I can tell that, genuinely, that you're the same. Like we're going to find a solution. We're going to
Exactly.
learn to deal with this and our physical symptoms, and we're going to think through our mental symptoms, and we're going to know that we're worth it, and we're going to just keep going on.
Well, and having those tools help too.
Oh, big time. Need
It
those.
it's I know a lot of people are like, even myself at one point, like, no, I'll be fine, I'll be all right, trying
Mhm.
to talk yourself out of it, but it really does help. Even if it takes you time to get accustomed to it, that's okay. That's, like we've said, is part of it. But
Mhm.
ultimately you kind of have to give in at one point, and it does get better and a little easier. But there's always going to be, like we said, challenges. So
Yeah. But I think that's the message of today. I think of our conversation is a couple things. I would say probably you're not alone. And, service dogs are a great tool, but also it will get better.
it does.
Yeah.
It's hard to think that it will, but it
But it
does.
will. Trust
It,
us. It will.
a good support system is important. There's a lot of free resources that you can look up. I found a free resource in my state that you can call and talk to someone for free. And it's, yes, anxiety based help, but they'll help anybody. So there's
That's awesome.
resources out there. So don't be afraid to ask for help.
Always ask for help. Absolutely.
Yes.
Well, thank you so much, Katy. It's been a
You're
really
welcome.
great talk. Is there anything else you'd like to add?
No, just like we've touched base, don't be afraid. Take your time, enjoy the process. All the hard times, your dog will get it, and it'll all come into place. All the hard times, all the tears, it's all worth it in the end. So
it is. Well, thank you so much, Katy, for joining us today.
You're welcome.
I really appreciate you sharing a little bit of your story and insights about PTSD and service dogs. Thanks so much.
You're welcome. Have a great day.
You too. Well, that's all for today. Thank you all for joining us. And thank you again to our special guest, Katy Collins, for talking with us and sharing her story about PTSD and service dogs. If you'd like to send us some love, please hit those like, subscribe, share, and follow buttons. And if you'd like to continue our conversation, please reach out to us on one of our social medias. We are at Mindful Pause Podcast everywhere. You've been listening to the Mindful Pause Podcast, the most awesome podcast on the internet, spreading awareness about mental health and service dogs. Take care.